Hello, this is Dr. Gay from Persisted MRI, and this is a typical patient who came in on their own to find out what was going on in the shoulder. They'd gone to their chiropractor because of shoulder pain, and they did some manipulations and were doing dry needling regularly in the back of their shoulder, hoping that the dry needling would help relieve the pain, but the pain persisted. So then she went to her orthopedic surgeon. They tried to get her an MRI, but it was denied by insurance. And so they said she should go to physical therapy for I think 8 or 10 weeks. And so finally she decided to just take matters into her own hands and figure out what was going on. So on this view of the shoulder, this is called an axial image. We see the round ball, the humeral head. It sits and rotates in a cup here. This is called the glenoid, part of the scapula. And we see a little black wedge along the front. Here, this is called the anterior labrum, a little fibrocartilaginous wedge. It makes the shoulder socket deep. And this is the posterior labrum, and this goes all the way around the rim of this cup here. And this is all bone, and the little dark area is the fibrocartilage, the labrum. And on this view, we're looking straight at the shoulder, so this is the top, outside, this is the deltoid muscle coming down over the side, and this is the shoulder joint. We see the humerus is the humeral shaft. We see the round humeral head rotating in this cup. And now we see the top and bottom of the labrum. Here we saw the front and back. On this view, we're looking at it from a different orientation. So we see the superior labrum and the inferior labrum. And we note the inferior labrum looks dark and uniform, so it looks like it is not torn. But the superior labrum is foggy. And we see this linear band here. This is a tear right through the superior labrum. And also there's a little chunk off the bottom here. So this is a tear of the superior labrum from anterior to posterior, a slap tear. It goes all the way from the front, all the way to the back. So this is what is causing her significant symptoms. And now she's going to go back to her orthopedic surgeon and get advice as to what to do next. Typically, they'll go in and do surgery and try to get them some relief. But just a really common case where patients are denied insurance and getting treatments that they may not need, and how MRI can be helpful just to know what is going on. So you know if the treatment you're getting is worth the expense and pain. And that's it. Thank you very much.